Well, the doctor's in the house, so get the pen, get the paper. You might want to take some notes here. New Life Functional Neurology and Endocrinology, Dr. Elliot Hirshorn. Hey, Doc, good to see you.
Good to be here. Thanks for having me.
Welcome. We just talked thyroids.
Well, we got
a DVD we're going to be talking about, but a lot of people have thyroid problems. Is that right?
They do. Yeah, it's pretty common. Much more common in women than it is in men, but it's pretty prevalent, and the symptoms can be very wide-ranging.
Why is it? Why? Like, why is it so prominent in women, and why do people have so many problems with it?
So the common symptoms can really be head to toe. So it can involve brain issues, so anxiety, depression as well, brain fog, focus, concentration, but it literally goes down the rest of the body as well.
Heart.
Yeah. If it's hyperthyroidism, can cause cardiac issues, but fatigue and insomnia are pretty common, as well as weight gain, and that's something that this time of year people are pretty focused on. And the reason why it can affect so many different areas of your body is because you need thyroid hormone in order to have proper function of every cell in the body.
Right. But you're not always checked for a thyroid, are you, with a normal blood test? I mean, sometimes that's not actually part of a blood test.
It may not be part of the common physical that you have every year. And in the standard of care for medicine, when they are looking at these symptoms coming into the office, they do run the screening test, which is a thyroid stimulating hormone. That's usually inside that normal range, but if people can still have symptoms even if it is within that normal range.
And can it also play a role in infertility? Like, if your thyroid is not on track, that could cause you to not get pregnant or have a harder time?
And we see that a lot. People coming in, they're wanting to have another baby and they're wanting to expand their family, and their hormones, reproductive hormones, aren't working as well as they should, and that certainly can be impacted by a thyroid function.
Well, why don't we mention your free consult? Now, you're in Simpsonville.
We are in Simpsonville. We help people all over the state and the region, so they don't have to be local. But anyone who calls today, the first 25 callers, we'll just do a free consultation to see if it's a good fit for us to work together. We'll talk about their case specifically. They'll meet personally with me, and there's no cost for that.
Well, that's if you call and mention this. Normally, there's about a $200
Yeah, it's normally about $200, but today we're offering that at no cost. They don't have to come to a seminar or anything. We're actually going to send them this free DVD as well. This will explain a lot more in detail about how the thyroid works and how we help people with that before they come in the office, so we can then answer any questions they have about that.
Because what if you just said, I'm tired, I don't want another kid, whatever, I'll just let this thyroid thing ride out. What could happen long term?
So the symptoms just continue to get worse, and so you might have a little bit of general fatigue now, but that's going to get worse. You're going to have difficulty sleeping, and really the thing I want to focus on is the #1 reason why people have thyroid issues to begin with is their immune system is actually attacking their thyroid. And so it's not...
I don't sound like that should go on for very long.
No, it's not. And so our focus needs to be, how can we make your immune system function better? So how do we change your diet and lifestyle so it stops influencing your immune system to attack your thyroid? And then how do we support better immune function through better diet and nutrition as well?
So diet can make a difference.
It can, absolutely. And if we get a hold of that on the front end, then they won't lead into other autoimmune diseases down the road. And that gets to your question about what can happen. It can lead to, worst case scenario autoimmune diseases. We're talking about psoriasis and multiple sclerosis.
All that stuff you don't want to get.
So once your immune system's confused about one tissue like the thyroid, it's much more likely to become confused and disorganized and start to attack other areas as well.
Are there other ways to treat it other than if you're diagnosed with and having to take a pill for the rest of your life, or is that kind of what we have to do?
That's a great question. So some people, in fact most people, will have to be on a medication, because when your immune system attacks the thyroid and destroys a portion of it, that portion's just not going to work anymore. So you have to replace that portion that's not working anymore with the medication. Some medications are better than others for certain people, but ultimately the medication does not address that underlying root cause where the immune system is attacking the thyroid. So that's where we work with diet, lifestyle, nutrition to help really support the immune system and give that piece that's not really part of the traditional standard of care in medicine.
This is complicated. Does this break it down to be real common sense?
It's about 30 minutes, and it breaks down the thyroid metabolism, how it works, and how all those symptoms are caused by this little tiny gland in your neck, and then it also talks about how we help with that as well.
Now, if you call that number, it's free, the consult. The first, what did you say? 25 people.
That's correct.
Simpsonville. But you'll get this in the mail.
Yep, so when they call the number, leave your name and number on the voicemail. We'll call you back this afternoon, and the team will get you the DVD in the mail, and we'll also get you scheduled for the free consultation.
New Life Functional Neurology and Endocrinology. That's a mouthful.
It is.
But it rhymes.
You got
neurology and endocrinology.
That's right.
Thank you for coming on. It's great stuff, and I'm glad that you're helping. Thank you for doing that. Very generous for you.
Dr. Hirshorn.
Yes. Coming up, the Children's Museum of the Upstate. Guess what? They've got new exhibits, and we're going to tell you what they are so you can get your children there this weekend. Don't move. That's coming up next.